seems to me when Congress and the president are considering legislation, and you think about the cost, and you think about, developing a fiscal plan for recovery, the thought occurs to me that there's really no point looking at a fiscal recovery plan until we have a healthcare recovery plan, because the one thing follows the other. And until we know what's happening with the disease, and that we have a plan for dealing with it, a recovery there, we really don't know what the fiscal requirements are going to be. So, and my open-ended question is, what do you think for the healthcare recovery policymakers should be thinking about? I mean, what does it take to get the virus under control and people comfortable going back to work?
So that's a really scientific question that I don't have the answer to in terms of getting people back to work. I think there's been a call, which I think there's a lot of discomfort with this call, but it sounds like the scientists are circling around a full a blood test to be able to, an antibody test to determine whether or not people have been exposed. So you can bring back those who've been exposed more readily and find out what's safe. I think that's a tough sell. First of all, we don't have the test yet. And second of all, how is everyone going to get it? And then, also there's a talk about creating a database to figure out anybody's been infected, who are all the people they've touched. So I think we're going to have to get back to work. It's interesting. One of my favorite justices of all times did say, and he was quoting someone else, very famous, said, something that's unsustainable can't be sustained. So all of us sitting at home is not sustainable. So we're going to have to figure out how to change that going forward with the best interests of all of us in mind. And hopefully we can be able to bring ourselves back to a place where we take what we can from this video learning and this online strategy that we've all developed, and bring what's good in that, and also do some really hard work looking forward. I mean, I don't mean to call out some other major issues facing us, but we need to figure out our healthcare system. So let's have that conversation. Bob, that would be a good conversation to have.
It is very hard trade-offs. So totally unprecedented situation. We're all doing things like the three of us here, broadcasting from our separate locations, and I'm not planning to crack a safe later on. So
it's our version of pirate radio.
Yeah, exactly.
Right.
So anyway, yeah, I mean, we're all going to need to figure this out. That environment is unsustainable, and yet we have to do the things that we need to do to get the virus under control.
Right.
So
well, it will be give us
no magic bullets.
Yep, and as we look over time, it would be really interesting to see the different types of healthcare systems, and not just how they've been able to respond to the emergency, but how they've been able to respond to the aftermath.
Right.
I think that's going to be a really interesting question.